Okay, last video of this summer semester. And we're coming to the second part of Singer's book, Rethinking Life and Death. And the second part is called Crumbling at the Edges. And the thing that is crumbling at the edges, he thinks, is what he calls the old ethic of sanctity of life. Yeah, in fact, why don't I skip ahead to chapter 9 and list, just to start off with, 5 commandments of this old ethic that he says cannot survive much longer, cannot survive advances in medical technology and changes in the way that we think about life and death. So, in chapter 9, he lists 5 old commandments. First old commandment is treat all human life as of equal worth. Now, of course, these rules sound wonderful. They sound absolutely correct. What he has argued, though, and will argue in depth in this second part, is that they only sound wonderful until you start picking at them, until you start trying to put them into practice with the kind of medical dilemmas that doctors and workers in hospitals are faced with on a regular basis. So, if you treat all human life as of equal worth, then that involves regarding anencephalic babies who will never have any feelings, never have a thought, as of equal value with, healthy adults or any other kind of babies who do have working cortexes, who will have thoughts, who already feel pain and feel joy in a way that an anencephalic child never could. And it leads to what he thinks of as absurdities, like Joey Fiore, who, if you remember from the first part, was that guy who's been kept alive. He had a motorcycle accident and then he had some kind of medical malpractice that led him to be in a persistent vegetative state, and he's been kept alive for 20 years. He is alive. I mean, some people want to say he isn't really alive because they want to change the definition of death. But Singer thinks that dodges the issue. He is alive, he just has a life that is not worth much. Obviously, if it's worth it to his family to keep him alive and they can afford to pay for it, then that's fine. But if it's a question of resources that the public have to pay for, then he should be very low on the list. He's not someone whose life matters to him because nothing matters to him. He isn't aware. Okay, so that's the first one. Treat all human life as of equal worth. He says that's fine until you start looking at cases like anencephalic children or possibly, severely impaired infants and so on. Second old commandment, never intentionally take innocent human life. Now this led to such things as you're not allowed to cause the death of a baby even to save the mother's life. That some Catholic theologians defend this, that you can't intentionally kill a baby, even kill a fetus, even when doing so is the only way to save a mother's life. There are, fortunately, thanks to medical technology, these cases are rare, but they still do exist, where the mother giving birth to the child, whether because of, so for example, there are some cases when it's discovered that a pregnant woman has cancer, and because of the hormones involved in pregnancy, this will just sort of supercharge the growth of the cancer if she goes through with it. Most Catholic theologians would allow abortion in that case, but if you're really taking it seriously, never intentionally take innocent human life, and you regard a fetus as a human life, you can't do it. And of course, that'll lead to the death of both people. Number 3, never take your own life and always try to prevent others taking theirs. Um, there's been there are still laws against committing suicide, which is a little bizarre. This is the only time you can be prosecuted is if you fail. You can never be prosecuted for successfully committing that crime. It's only attempted suicide that you could ever be prosecuted for. And of course, this leads to bans on assisted suicide, um, like what happened with Dr. Jack Kevorkian in our own state of Michigan. Not his earliest cases, because they hadn't passed a law against assisted suicide, but because of him, they did, and then they prosecuted him under it. Be fruitful and multiply is the fourth of the Old Commandments. There's a story in the Old Testament of Onan who spilled his seed upon the ground. There was a joke once why did Granny call her pet parrot Onan? Because he always spilled his seed on the ground. You have to know your Bible to get that joke. So in the Old Testament, it was considered very wrong not to be fruitful and multiply. But of course, this makes sense to a small nomadic tribe, which might die out unless its members keep having as many babies as possible. And, particularly when babies died very often very young, you want to keep having babies so that at least one survives. But in today's overcrowded earth, it doesn't make as much sense. Finally, treat all human life as always more precious than any non-human life. I didn't have you read chapter 8 of the Singer book. Singer is perhaps most famous in the philosophical community for his work on, for lack of a better term, animal rights, although he's not a big fan of the notion of rights. But certainly he has argued against the mistreatment of animals because of their ability to feel pain and to suffer. And chapter 8, his most famous work is probably a book he wrote in the late 70s called Animal Liberation, very influential in the animal rights movement. And chapter 8 sort of covers some of those issues. But what he argues is that, for example, an anencephalic child who can never feel pain, can never be conscious, he would say the life of such a child is not as valuable as a healthy adult chimpanzee who is capable of feelings, is capable of emotions, capable of feeling pleasure and feeling pain, and yet it certainly used to be the case that chimpanzees could be experimented on. Actually, very recently, that has been banned in the United States. And there was actually some flack about that because there was a disease that's killing a lot of chimpanzees, and they wanted to test a virus, an inoculation against it, but because they just banned testing on chimpanzees, they couldn't test the inoculation. But essentially, Singer's point is, it's just not the case that all human life is more valuable than any non-human life. There is human life, like anencephalic children, that is potentially less valuable than non-human life. Like, for example, Coco the gorilla, who can do sign language. We assume that he would certainly assume that her life is more valuable than a human in a persistent vegetative state or something like that. Okay, so those are the Old Commandments. That's the ethic that he thinks is crumbling at the edges, as this part is called. Chapter 5 is a discussion of abortion. It gives you a little potted history of how abortion actually wasn't widely opposed. For example, Jesus never says anything about abortion, never mentions it, or gay homosexuality for that matter. And the great Christian philosopher, perhaps the greatest of all Christian philosophers, St. Thomas Aquinas, while he did say that many abortions are wrong, he said that abortion was actually okay until the quickening, which has nothing to do with the Highlander movies, if you're familiar with them. And the quickening is when he thought the soul entered the body of the fetus, which interestingly he did not think happened at conception. He thought it happened 40 days after conception for males and 80 days after conception for females. You know, women get started later, apparently. So if you had an abortion before those, that would be perfectly fine. You wouldn't be killing anyone because they're not really alive. Now, actually, advances in medical technology, relative advances in medical technology, was what led to the change in that. And they thought that the embryo was alive from conception, which of course it is. It's alive from conception, but so are the sperm and egg. A sperm and egg are alive too. But, you know, we're now, apart from Catholics, we're now perfectly okay with using spermicides or using contraception. We don't think destroying sperm is murder. We don't think destroying eggs is murder. We might think that destroying it if it was somebody else's property is a violation of those people's rights, but it's not a violation of the sperm's rights. It's just a piece of, it's just a living piece of tissue, very tiny. So they thought that conception was when the quickening happened. I heard one story of this, which was that Aquinas thought that ensoulment actually happens when the fetus takes on human form. He was following he was very much influenced by the great Greek philosopher Aristotle, for whom a soul was basically like the shape of the human. So once you take human shape, you have a soul. It's not like the idea that we have of a soul now, which is this immortal thing. That's actually more to do with the Greek philosopher Plato, who Aristotle disagreed with. But so Aquinas thought the quickening happened when the fetus takes on human shape. And the reason why they moved that back from his 40 days back to conception was because a person looking at a sperm through a microscope, a primitive early microscope, thought that the sperm were human shaped. They thought they were little swimming guys in there. And so they decided, and this influenced the Catholic teaching of, you know, you can't even kill sperm. But for whatever reason, it got moved back, and it was only basically in the 19th century in England that abortion became illegal. All abortions. And Singer gives a little history of why he thinks this is. He thinks part of it was a sort of turf war between so-called real doctors who had to pay to get a license and midwives who performed a lot of the, probably the majority of births. And the AMA in America also crusaded to outlaw abortion. And that was the state of play. From the 19th century to about the 1950s, all abortions were illegal. That didn't mean that they didn't happen, of course. It just means that they happened illegally. They happened all the time, you know, just in back alleys. And you're probably familiar with the symbol of the, or one symbol of the pro-choice movement is a coat hanger with a line through it. That's because a simple way to perform, a simple and very dangerous way to perform an abortion is to use a coat hanger, a wire coat hanger. And that was pretty common when abortions were illegal. Okay, so what changed? When did abortions become legal? Even in America, and certainly in most places in the so-called developed world, except for very Catholic countries like Ireland. Well, one reason, according to Singer, is thalidomide, which was never legal in America, but when I was a kid growing up in England, you would still see people whose mothers had taken thalidomide when they were fetuses, and they were born. Typically, it didn't affect brain capacity, as far as I know, but what it did do is it basically caused you to be born without limbs, without either without arms and legs, or without arms or legs, or sometimes you would have just fingers growing out of your shoulder, things like that. Very severe, what we would call birth defects. And that was as a result of taking this drug, thalidomide, which caused no birth defects in rats. They tested it extensively on rats, but unfortunately this is one of the key differences between rats and humans, because it did on humans. And it was prescribed, tragically, for morning sickness, which you get when you're pregnant, of course. Well, Sherry Finkbane of Arizona took some of this while she was vacationing in Europe, and was worried that it, then heard the results of what was happening in Europe, and had an ultrasound, which, well, no, she didn't have an ultrasound. She was just worried that her child would have these birth defects. And in fact, when she went to Sweden and had an abortion, it turned out that the fetus showed the effects of thalidomide. So part of it was thalidomide, and part of it was the number of women who were dying with illegal abortions, that coat hanger thing, which can be dangerous if not done by trained physicians. If done by trained physicians, abortions, certainly early abortions, are very safe. But if they are done by people in back alleys with straightened coat hangers, then you can puncture the uterus, you can lead to massive internal bleeding. It's a bad scene, and women were dying in fairly large numbers of this. So those two causes led to a movement to have abortion legalized. And in fact, before Roe versus Wade, the famous Supreme Court case in 1971, it had already been legalized in many states. As he says, 18 states, including California and New York, home to or within 100 miles of 2/3 of the population of the United States, before Roe versus Wade, had allowed some abortions to be legal. Now, in 1984, when the book was published, about 1.5 million legal abortions are carried out a year, the majority on women in their 20s and 30s. It's much more common in, for example, Russia, where birth control is hard to come by, and actually, I think Japan, where I believe I'm right in saying the pill is still not legal. Birth control pills are not legal in Japan, I think I'm right in saying. But yeah, Russia in particular, famously, they use abortion as a means of birth control. It's very common. So the reason why abortion became legal is largely because people were worried about having children who had birth defects. And between 1972 and 1987, this question was asked of a national sample 13 times. Please tell me whether or not you think it should be possible for a pregnant woman to obtain a legal abortion if there is a strong chance of a serious defect in the baby. The answer has always been between 75 to 78% yes. Now, I don't know if that's changed in recent years. I suspect that it has, but probably not to a big degree. But Singer says this shows a majority prepared to make quality of life decisions. In other words, they are prepared to allow the death of fetuses if they judge the quality of the life that they would have to be lacking, which is a rejection of the sanctity of life view, that all human lives should be ranked the same. Another reason to challenge the idea that the kind of life that should be protected by laws against murder begins at conception, there's a couple of interesting points. One, brought up by a Catholic theologian, is twinning. And this should make us think of, if we can remember back that far, you might remember Feldman's discussion of the fission of Alvin the amoeba. And then he says, suppose Alvin splits into two. What happened to Alvin? Well, Alvin ceased to exist. He didn't die. That was the point that Feldman was making, but he ceased to exist. Well, the same thing, of course, happens to human embryos when twinning occurs. Identical twinning, that is. In fraternal twinning, there are just two eggs, whereas with identical twinning, you have a single embryo, and for some reason that we don't know, it divides, and then you get two identical embryos. Well, the question is, if we regard human life as starting at conception, then a human went out of existence when twinning occurred, just as Alvin went out of existence when he divided into two new amoeba. Well, whoever that human was that was conceived as a single, when the single egg was fertilized, no longer exists, and you have two new ones. If we say that that conception happens, I mean that human life begins at conception, then we'd have to say that, you know, whenever twinning occurs, it's a tragedy. Somebody has ceased to exist. But I don't think we believe that. Second point is syngamy. Syngamy is when the gametes of the two parents, the genetic materials of the father and the mother, join. And this actually doesn't happen at what we normally call conception, which is when the sperm meets the egg, because actually the egg is massive in comparison with the sperm. So one sperm makes it first to the egg, passes through the outer barrier of the egg, and this causes a chemical reaction which hardens the surface of the egg, causing all the loser sperm to bounce off, because you don't want more than one sperm fertilizing an egg. And incidentally, this is why this fact that a fertilized egg, the outside hardens, the surface hardens, that's why fertility clinics don't just freeze sperm and egg separately. They tend to freeze fertilized eggs, because actually fertilized eggs are much tougher than unfertilized eggs because of this harder outer surface that happens when the sperm enters the egg. So it makes the eggs much more durable. So that's why when you do in vitro fertilization, what they'll do is they'll give you a drug that causes you to produce a lot of eggs at once. They'll take all of these eggs and they'll fertilize all of them, and then they'll just implant one, or if you're Octomom, they'll implant 8. They'll implant a couple maybe, but then they'll freeze the rest in case this go-round doesn't work, which failure is quite common. But if it does, what happens is you have these fertilized eggs frozen in fertility clinic freezers, and they'll say, well, we'll keep them until you tell us that you don't want them anymore, in case, you know, you want a second round, or you might want them again. But what tends to happen is that the people, once they've got their they've got their baby, they lose contact with the fertility clinic, and the fertility clinic is left with a freezer full of unwanted fertilized eggs, and they just dispose of them after a set, because, you know, it costs them money to keep them frozen. Or you'll have occasional accidents where the power goes out and all these fertilized eggs are destroyed. Which, if you believe that life begins at conception, that's mass murder. People who believe that life begins at conception should be picketing fertility clinics, because they dispose of fertilized human eggs on a regular basis. But back to syngamy. Syngamy actually happens about 22 hours, nearly a whole day, after the sperm meets the egg, because it takes a while for the sperm to travel across through the interior of the egg and bring its gametes to the genetic material of the egg. And this was actually relevant because this team, Wood and Trounson, wanted to carry out research on embryos, and they were forbidden by laws of the Australian state they were in, that forbade the creation of embryos for research unless those embryos were later brought to term. So the way they dealt with it was they fertilized the eggs, but they destroyed the eggs before singamy occurred. So they had 22 hours to observe the egg, but no. So they didn't think that life started at conception. They argued that life started at singamy, or at least that's the earliest you can say it did. Now, what you might say is, all right, an embryo, you might be convinced by this and say, okay, a fertilized human egg at conception is not a person. It's not murder to kill them. However, it's not yet a person, but they have the potential. Obviously, there are very few people who could be presented with a fertilized human egg, which, you couldn't see without a microscope, and a fertilized gorilla egg and could tell the difference. In fact, human embryos up to a certain stage in development have gills. Scientists argue that's because that's a remnant of our, past evolutionary history when we were water-going creatures. Or I don't know if that's the reason, but I've heard that. But certainly it's true that embryos up to a certain stage in development have gills. And it's actually not before a certain stage in development that it is decided whether you are male or female. All embryos up to a certain stage in development are female, which is why there's a scar in men going between the base of the testicles to the anus, which is where they had essentially a vagina, but it fused when they were exposed to certain chemicals in utero. But all of these things, we go through various stages of development as fetuses. What you could argue is, sure, okay, they're not humans yet, they're not human people yet, but they have potential. If you let them develop, they will turn into humans. Every one of us was at some stage a fertilized egg that was, allowed to develop. Like the bumper stickers say, smile, your mum was opposed to abortion or something like that, because otherwise you wouldn't be here. Of course, that's not true. Your mum might not be opposed to abortion. She just might have wanted you. There are plenty of pro-choice women who have children. They just say that they want the choice. They just happen to make the choice to have you. But I'm not going to argue bumper stickers. Okay, so the potential argument. Well, this idea that the potential that a fertilized human egg has makes it of the same value as an adult human has been criticized by many philosophers. He points out, Singer criticizes this argument by a guy called Noonan, which is, it's an article that is still anthologized, even though it's rather old, that points out that modern technology has shown us that fertilized human eggs die at a much higher rate than we used to think. The probability of a fertilized human egg before it implants, the probability of it surviving is about 30%. So think about that. 70% of fertilized human eggs just die before they implant in the wall of the uterus. Should we be holding all these funerals for them? Is this a tragedy? This is like, if you truly believe that life begins at conception, or humans start at conception, then this is like finding out about, 70% of the world's population has been secretly murdered. And secretly murdered by whom? Well, not any human. Presumably this is something that God allows to occur. So he suggests that should cause us to rethink this idea that a fertilized human egg is, or ask ourselves if we really believe that. Do we really believe, again, that fertility clinics are committing mass murder when they dispose of fertilized eggs? I had an ex-student once who posed this question in a newspaper. He wrote a letter to a newspaper and he said, imagine there's a fire at the fertility clinic and your assistant has passed out from the smoke at one end of the lab, and on the other end of the lab is a tray full of 100 fertilized human eggs. Who do you rescue? He said everybody would rescue the adult human, despite the fact that if you really believe these are 100 people, you should obviously save them first. And he suggested that's because we don't really believe that. Okay. Now, Singer describes a famous anti-abortion argument, or a simple version of an anti-abortion argument, which is, first claim, it's wrong to take innocent human life, always. Second claim, from conception onwards, the embryo or fetus is an innocent human and alive. Therefore, conclusion, it is wrong to take the life of an embryo or fetus, essentially, or, to put it more strongly, abortion is murder. Now, the normal criticism of this, the normal pro-choice argument, is to argue that the embryo or fetus is not a living human, to say that you have to be capable of certain things to be a living human. And he says he's not concerned with making that argument. He said, sure, you could say that an embryo is a living human. It's certainly alive. It's certainly not any other animal. It's a human. It's not a goldfish embryo. So what he wants to say is he wants to argue the first premise. It's wrong to take innocent human life. And he says, actually, in some cases, it's not wrong to take innocent human life. As, for example, with the case of anencephalic babies, or with the case of Tony Bland, who we came across in the previous part. Tony Bland is obviously innocent. He didn't do anything wrong. He's obviously human. He's alive. His lungs are working. His heart is beating, but it is not wrong to cause his death. And he said we can make the same argument about embryos, and that wouldn't mean that abortion should be legal. Some people have suggested, he talks about someone called Hans Martin Sass, who suggests a brain life criterion. We've already seen a brain death criterion for when death occurs. What about a brain life criterion? That is, you become alive when your brain starts working, when brain waves can be detected. And some people like that idea. And it happens, life of the cortex, some people estimate, starts at about 10 weeks. But what he points about that is, again, just as saying that a brain dead person is actually dead seems like a legal fiction because they're warm, they're breathing, their heart is beating, and you're claiming that they're dead, that just seems wrong. Similarly, the sperm and the egg are alive. The embryo is alive. Why claim that life begins when you detect brainwaves? That's just misusing the term life. Maybe we start caring about when the brain begins, but that's different. He thinks that it's wrong to talk in terms of brain life. Certainly some people would argue that's when they become persons, where, if you remember my little Venn diagram from the last class, persons and humans overlap to a great degree, but there are some humans who aren't persons, like Tony Bland, and there's potentially non-humans who are persons, like Coco the gorilla or E.T. All right, next chapter, chapter 6, making quality of life judgments. Again, there's a little bit of history about the Baby Doe case and the Reagan administration. Baby Doe was a Down syndrome infant born with something that's fairly common with Down syndrome children, a problem in development in the esophagus, so that there was a blockage. Now, if Baby Doe had not been Down syndrome, then they would have done a surgery on this, no problem. They wouldn't have just allowed a normal baby to die just because they had a blockage in their esophagus. It was obviously because Baby Doe was a Down syndrome child that the parents didn't really want, that they allowed they refused the surgery and allowed Baby Doe essentially to starve to death. Now, notice that what Singer wants to do is argue that this kind of thinking is some of the kind of absurdities you get from following what he calls the old ethic, because he says, um, first of all, if you he doesn't say that it was right to let Baby Doe die. But what he does say is, notice that this kind of strategy follows from saying that either you are in the circle of life, and your life is of absolute value, or you're outside the circle. And all, but well, actually, it also follows from the rule about never being allowed to kill, actively cause the death of, because they decided that a Down syndrome child was not one that they wanted. So that meant that doing surgery counted as extraordinary efforts to keep this child alive. Whereas if they had decided that the life was valuable, it wouldn't have been extraordinary efforts. It would have been necessary efforts, the kind of efforts that you should never refuse, like a blood transfusion or something. But Singer says, look, if you make the decision, if you're going to cause the death, and it's okay to cause the death of human life that is not of sufficient value. He doesn't say that that would be Down syndrome children, people. But if you make this decision, it should be permissible to give them an overdose of some lethal drug, rather than keeping them in a maternity ward, watching them waste away, knowing that you intend them to die. You're not feeding them, they're starving to death, and yet you maintain this pretense, oh, we can't kill them. You intend to kill them. You know that they are going to die, but somehow you can't kill them. He says that's rubbish. Look, either their lives are of a sufficient quality of life, in which case, for God's sake, you can't kill them. You've got to keep them alive. You've got to do the surgery and so on. Or they're below this line, in which case you should be able to cause their death, give them a lethal overdose, as happens in the case of people in the next chapter, where he argues people should be allowed to commit suicide, or as one of the law lords in the case of Tony Bland said, why is it we can't, we let him starve to death slowly when we, instead of just giving him an overdose of morphine or something. Now, you can read the little history of the Baby Doe cases, and how doctors vehemently opposed them. Now, what was being stressed at the time, and Reagan said this clearly, is that he favored a sanctity of life ethic, and where he says, I think that all life is of equal value, and I'm not going to say that, the quality of your life affects whether or not you live or die. That's horrific, he said. However, what Singer argues is that buried in even the Baby Doe guidelines, which supposedly showed a sanctity of life ethic, was a hidden quality of life ethic. In one of the smaller posters, if you read the history, you see that the posters get progressively smaller. The Baby Doe guidelines, this statement was released. The law does not require the imposition of futile therapies, which merely temporarily prolong the process of dying of an infant born terminally ill, such as a child born with anencephaly or intracranial bleeding. Now, what he says is that's just bogus. An anencephalic child is not terminally ill any more than, someone with polio. That you can keep them alive. And in fact, baby K was kept alive on his mother's wishes for quite a long time. So what you're doing because you've decided that anencephalic life is not worth living, you're claiming that they're terminally ill, which allows you to withdraw treatment from these children, which is not sanctity of life. A full-blown sanctity of life would say it doesn't matter if they will never have a thought, It doesn't matter if their life is short. You still have to do everything in your power to keep them alive for as long as you can. And he says the reason why sanctity of life proponents don't tend to hew that line is because they know that the public is overwhelmingly opposed to that. So they've got to temper their strategy so that they don't appear to be disagreeing with what the vast majority of people believe. There's a case in here, all of these cases are tragic, but the case that gets me every time is the Linares case, where Rudy Linares, the father, his child, Samuel Linares, choked on a balloon, at a few months old, and it blocked oxygen to the brain so that he had a brain bleed and entered a persistent vegetative state. It's cortically dead. But because of these baby doe guidelines or similar guidelines, the hospital refused to remove the life support from the baby. So, of course, they judged that, they weren't allowed to kill this child. But he, as you know, if you've read the story, came in with a gun and said, I'm not going to hurt anybody, I just want to let my child die. And he unplugs the respirator and hugs his child until the child stops breathing, and then gives himself up. And it's just heartbreaking. Because of course, before the baby choked on the balloon, they envisaged the child, Samuel, growing up and, outliving them. But once this happened, they knew that this life was not of value, and wanted it to end as quickly as possible so that they could grieve. And a jury understood this, and they acquitted him. They refused to indict him for homicide, despite the fact that he's caused the death of this child. And of course, what Singer says is the reason they refuse is because the jury doesn't think that this is a life worth living, which is a quality of life decision. So he just got some weapons charge. Unlawful use of a weapon was given a suspended sentence. All right, let's see. Asking for death, next chapter. Before we move on, there is this distinction between extraordinary and ordinary treatment. And even Catholic theologians say you're allowed to withhold extraordinary treatment. You're not allowed to withhold ordinary treatment, but you can withhold extraordinary treatment where it's futile. So this allows even some sanctity of life proponents to say, well, you don't have to keep anencephalic children on respirators. But what Singer wants to argue is that, again, there's a hidden quality of life judgment, because if it was really just about the treatment, then we would know what treatment counted as extraordinary. Is a respirator extraordinary? It either is or it isn't. Well, the answer is it is extraordinary when it's used to keep an anencephalic child alive, but it's not extraordinary when it's used to keep a polio child alive. So what counts as extraordinary and ordinary depends, says Singer, on whether or not you value the life. So really, you're making a quality of life judgment. You're just trying to pretend you're not. Okay, asking for death. This is about euthanasia, mercy killing. And there's, again, lots of harrowing examples. And leading up to legalized euthanasia or assisted suicide in Holland. And now, actually, as it mentions, it was just legalized at just as this was going to press, it legalized in Oregon. Turns out assisted suicide, you can get lethal prescriptions in Oregon, and surprisingly few people get them. I mean, some people get them, but you have to get lethal prescription in Oregon. You have to get 2 doctors to give you a diagnosis, 2 different doctors, and you have to confirm that you still want to go ahead with it after a period. So just to show it's not like some temporary, depressive state, you have to confirm after like a couple of weeks or something that yes, you really do want to go ahead with this before they'll give you the drugs. And some people get the drugs and never use them. So it's actually a comparatively small number of people, which was the worry at the time that they passed the law is that there would be this epidemic of people killing themselves. But it's turned out to be something of a trickle. And now it's legal in Washington State too, I believe. And it's also legal in Belgium since the writing of this book. There was... so let's see. He talks about the case, whether or not one of the reasons why the euthanasia cases in Holland or the Netherlands were criticized, because they pointed to 1,000 cases where in the Canadian Supreme Court case, Sue Rodriguez, one of the cases that Singer talks about, wanted to be helped to die, and she was in Canada, and the judge, they ruled that she couldn't. She did it anyway. Or she got a doctor, and the doctor admitted it. But the reason why the court said she couldn't is said that critics of the Dutch approach point to evidence suggesting that involuntary active euthanasia is being practiced to an increasing degree. Now, actually, this isn't allowed in Holland, and presumably what they're pointing to is 1,000 cases out of 48,700. 1,000 were cases in which a doctor supplied, prescribed, or administered a drug with the explicit process of hastening the end of life, but without an explicit request from the patient. Now, is this involuntary active euthanasia? Is this like doctors saying, yeah, this person's hogging a bed and she's pissing me off, so I'm gonna get rid of the old biddy? No, these were cases, a lot of these were cases where discussion had gone on and they were in terminal and in great pain. And a lot of these were cases where, like Tony Bland, consent couldn't be given because they were incapable of consent. They were past that point. So, again, Singer argues that this is not a sign that that legalizing euthanasia leads to massive disaster and everybody being murdered. Death panels, if you remember that debate. And if you don't, good, because it wasn't worth remembering. All right, this brings us to the last chapter, chapter 9, where he, I've already given you a preview of that, where he lists the 5 old commandments, rules of the ethics, of the sanctity of life ethic, that again sound very good, but he says lead to horrible moral dilemmas in cases when we're dealing with hard cases like Tony Bland, like people in persistent vegetative states, like anencephalic children, and so on. Before he lists those, he says, here are some of the... he draws an analogy between ethics and Copernican astronomy, or pre-Copernican astronomy. Copernicus was the one who suggested a heliocentric view of the solar system. That is, before Copernicus, Aristotle actually had a view of the universe where the Earth was at the center of the universe. We were surrounded by these crystal spheres, and the heavenly bodies were all embedded in these crystal spheres that moved them around. And actually, this was making prediction of the behavior of the heavenly bodies more and more difficult, but they sort of tinkered with the math and they made it work. Then along comes Copernicus, and he suggests a totally different model. He says, well, actually, the sun is at the center of the solar system, and we're rotating around it, as are the other planets. And that actually is a much better model of the movement of the planets. It's still not perfect, though. So actually, if you've got one of these tinkered with pre-Copernican models, it might do just as good a job of predicting the position of, say, Venus at any point in the future as a simple Copernican model, because Copernicus actually made some mistakes too. He thought that the orbits were all perfect circles, when in fact some of them are ellipses and so on. But to make the Copernican model work, they have to make all these sort of fudges and say, well, you know, we treat it as if it's moving around the Earth, except we say it makes this funny little wobble because, and they make up some reason. And he says the same kind of thing is happening with sanctity of life. We say all life is of equal value. but life doesn't begin until this point, or when your brain, or life ends when your brain stops working, like the brain death criteria, despite the fact that you're breathing and your heart is beating. So that's one sort of fudge to help save the sanctity of life ethic, is redefining death so that breathing humans are dead. We've talked about the distinction between ordinary and extraordinary treatment. Well, all life must get ordinary treatment, but all life you can take away extraordinary treatment. It's just all treatment is ordinary if you're normal, and a huge range of treatment is extraordinary if you're anencephalic, except maybe a feeding tube. Even a feeding tube has to count as ordinary. So if you are so we have cases of people in persistent vegetative states where they take them off the respirator because that's extraordinary treatment, but leave them on a feeding tube, and it turns out they can actually survive. I don't know if Joey Fiore was one of these, but that happened. Was it Nancy Cruzan or Karen Quinlan? One of them. They thought that she was going to die when they took away the respirator, but no, her brainstem was still active, so it was making her lungs work, and she continued to live for years and years. And because they couldn't take away the feeding tube because that's ordinary treatment, this mindless body continued to exist for a very long time against their wishes. Euthanasia is permitted if the intention is to relieve pain. There's actually a long-standing Catholic doctrine called the doctrine of double effect, which allows abortion in some cases, so long as your intention in doing the abortion is not to bring about the death of the infant. Well, if my intention is to save the mother, then it's okay if it just happens to have the effect of killing the infant. That's an unintended effect, and that's all right. And Singer says, well, that's just causes people to pretend that that's their intention. Like the famous case, the murder case, where the doctor gave his old patient an overdose of morphine, and he said to ease the pain, when he gave her a lethal dosage. Yes, morphine does ease the pain, but it's pretty hard to argue that that much morphine was what was needed to ease the pain. Non-treatment is permitted for disabled infants, like in the case of where the doctor said, and it was common practice to allow non-treatment of baby dough, and there was a British case just like that with a similar intestinal blockage. So it just means that these kids starve to death. Now, they're given pain-killing drugs, so they're unaware, they're in a morphine haze, but still, stop denying that what you're doing is trying to bring about their death. Be upfront with it, and then we can have the argument about whether or not they have a high enough quality of life that you're allowed to do that. Denying that humans exist before birth or viability, that's a game that Singer doesn't want to play. We all started from, sperm and egg, and they're human, so why quibble about when humans begin? Quibble about when their life becomes valuable, when their life becomes of such value that it would be murder to kill them. And then the last one is there is a taboo made on comparisons between humans and non-humans. You can't compare a Tony Bland to a gorilla, because that's just monstrous to compare a human with a non-human. And Singer says, well, actually you can, and the gorilla comes out ahead, because a gorilla, so long as the gorilla has a working cortex, it can have feelings and sensations, and it's ahead of Tony Bland in that respect, after his cortex was destroyed. So actually, we should treat it better than we treat Tony Bland, or at least we should care more about its life, because it certainly cares more about its life. But again, that's in chapter 8 where he discusses that. Okay, so we looked at the old commandments. The new commandments that he suggests as an alternative, as a replacement for the sanctity of life ethic. So this is his sort of quality of life ethic. First one, recognize that the worth of human life varies. Again, this doesn't sound very nice, does it? This sounds like slavery or something like that. But he's certainly not advocating that. He's saying that it varies according to the state of your cortex. Factors affecting the worth. Consciousness. Are you capable of, not whether you're awake, but are you capable of conscious? Do you have the brain apparatus for it? Capacity for physical, social, and mental interaction with other beings, having conscious preferences for continued life, having enjoyable experiences. So, for example, someone like poor Lillian Boyes, who had a horrifically extreme version of arthritis, so that she screamed in pain constantly, the quality of her life is not worth prolonging because she doesn't have enjoyable experiences. Others' attitude towards your life. We don't want to say that, whether or not you get to live is whether or not you have people who care about you, but isn't that what we actually think? I mean, this would mean that, unwanted orphans have less of a quality of life just because of the fact that nobody wants them. But given the state of the world, you have to have someone to care for you. Unless we have an amazingly expensive social safety net, then that's going to happen. Finite medical resources. Given that there's only so much medical resources, there's only so many beds in the hospitals. That's the reason why the new brain death criterion was brought into effect. Because once they invented the respirator, all these beds in hospitals were filling up with people who had destroyed their cortexes but were being kept alive on respirators. So they decided that it was a medical emergency, that these people whose lives they did not value were taking away medical resources from people with functioning brains. So they decided, okay, we're going to make them organ donors because we're going to claim that they're dead. What they should have done, according to Singer, is admit that their value of their life was not such that it was worth keeping them alive. But they are alive, he says. Okay, 2. Take responsibility for the consequence of your decisions. Don't say that you're not doing anything wrong when you're just withdrawing extraordinary treatment, or the doctor who says don't feed baby doe. I'm not doing anything wrong because I'm not actually giving him a lethal injection. Please, it's just as bad. You're causing his death. Now, if he has a low enough quality of life, it's not wrong to cause his death. But you are causing his death, and admit that. Inaction that causes death is just the same as actively causing death. Don't make this distinction that you can allow people to die, you just can't actively kill them. Passive euthanasia is still euthanasia. Sanctity of Life makes this hard distinction between passive euthanasia, allowing to die, and active euthanasia, actively killing. And you can't do the former. Well, why not? If death is your intention, you know what's going to happen. Bring it about quickly and humanely. Isn't active euthanasia better in some circumstances? Number 3, respect a person's desire to live or die. This is with the euthanasia. We should allow assisted suicide. Killing a person against his or her will is very wrong, but killing a being who wants to die is not wrong, because we're respecting their desire to die. Number 4, in replacing be fruitful and multiply, is instead bring children into the world only if they're wanted. So birth control, abortion, those kind of things should be legal and supported because of, we're running out of resources on the planet. Do not discriminate on the basis of species. That's in response to the old one, which is treat all human life as always more precious than any non-human life. And again, he discusses that in chapter 8. Now, he says that the new commandments give answers to some of the puzzles that we've discussed. So, for example, brain death, anencephaly, and cortical death. Dr. Shen's dilemma, if you remember, was he had a baby that had a brain bleed and its cortex was dead, and then they had a baby that needed a new heart, and he had to let them both die because he couldn't harvest the heart from the cortically dead infant. Under the new ethic, he would be able to. even though the child is obviously alive, which is why the heart is useful, it doesn't have a life worth living, so you can make it a donor. Now, when parents don't want to allow their children to die, even if they're anencephalic, Singer doesn't say we should say, well, too bad, we're going to take your child. It's just in cases where the parents do want to, and there was that case where the mother did want to make her child, her anencephalic child, a donor, and she wasn't allowed to. Now he discusses if we allow late-term abortions, does that mean we should also allow infanticide? Because there's very little difference between an 8-month, there's no difference between an 8-month-old fetus and a preemie, an 8-month preemie. They're the same entity. They have the same capacities. Should we be allowed to kill an 8-month preemie? So birth is the only difference between them. But he says, well, birth may be relevant because the mother's right to control her body is no longer relevant if the child is outside her body. That's what's relevant in the case where the fetus, it's still a fetus inside her. And there may be other people who want the baby and can adopt it. But he does say whether or not the child continues to live should be up to the parents. There was that discussion in one of the chapters of exogenesis, where he says, hey, modern technology could one day solve the abortion dispute, because the abortion dispute says the pro-choicers say, I want the right to control my body. It's my body, and you shouldn't tell me what I do with it. And then the pro-lifers say, yes, but it's a living thing in there with the right to life. You shouldn't be allowed to kill it. And he says, well, in the future, we should be able to take an embryo out of a pregnant mother and put it in an artificial womb. And he says this should please both sides, because the woman gets to no longer have another human inside her, so she has control over her body, and it's as if she's had an abortion. And the pro-lifers get the fact that the fetus comes out alive and is not aborted. Everybody wins. And in fact, everybody hated this. Everybody was opposed to this idea, which suggests that the reasons each side is giving are not the real reasons. What he thinks is actually more important to pregnant women is the right to control what happens to their children. And think this actually comes up. Suppose you and you're part of a couple who are using IVF technology to conceive, and you have some frozen embryos, and you're not going to use them. Suppose somebody tells you, well, you can't destroy them because they're human beings. We're going to adopt them. We're going to adopt them and implant them inside some other woman who wants a child, and there's nothing you can do to stop it. I think you would be outraged. You would think, no, I get to decide. That's my genetic tissue. I don't want it to become a human being. I want that to be destroyed. I think a lot of people would take that view, and I think that's behind the abortion debate. And Singer would say, you have the right to do that. Now, Singer and a colleague, Helga Kuzer, suggests that after 28 days, the baby should be granted the same rights as an adult. So he's suggesting infanticide should be legal up to 28 days. That's pretty hardcore. Okay, summary. The two central assumptions of the old ethic that Singer rejects are: we are responsible for what we intentionally do in the way that we are not for what we deliberately fail to prevent, which is the distinction between active and passive euthanasia. He says we can't maintain that. If you know what's going to happen, you're responsible, even if it comes about from an omission of yours. And the lives of all and only members of our species are more worthy than protecting than any other human being, any other being. So the life of an anencephalic infant is more valuable than Coco the gorilla or the last Siberian tiger or a blue whale. And he says that's not true. There's some human lives that are just not as valuable as some non-human lives. And we should just accept that. It seems traitorous somehow to accept that. It seems like we have duties to our own species. But he says that's just a relic of an old way of thinking, and we shouldn't be trapped by that way of thinking. There you go. Now you can see why he's a controversial figure, and actually the other reading I gave you is from Harriet McBride Johnson, who is a disability rights activist, or was. She died recently. Why she views him as a very controversial figure, because she thinks that he's arguing that lives such as hers are not valuable. He isn't, of course, because she has all the capacities that he says are valuable and that put you above the line. But because he advocates allowing people to have an abortion if they find out, for example, that their fetus has Down syndrome or some other abnormality, she says that this means devaluing the lives of disabled people. And you get to read an article of when she meets him and has an argument with him. Well, I hope you've gotten something out of this course, and don't forget, you need to have 4 papers completed by Friday. So if you haven't done it, and most of you haven't, get on it. But of course, most of you aren't going to watch it this far, so my words will fall on deaf ears. But those of you who did, good for you. Hope you got something out of the course, and good luck on your final assignments.